The season of giving, and we know all about that, but there is a such thing as too much giving, particularly when it comes to the flu. The cases of Alabama are on the rise now, and Dr. Edward Kahn from the Jefferson County Health Department is here to talk about recovering from the flu and also keeping you from getting it. Good morning. Good to have you here with us this morning. All right, let's first talk about the State Department of Health had first said that it was regional in terms of the characteristic of flu and the people getting it. Now you're saying it's widespread. Explain the differences and what do you mean?
So every week we keep track both statewide as well as this is done nationally by the CDC as to the flu incidence rates. And typically, especially in Alabama, we see the greatest peak in the latter 2 weeks of December. So in week 51 we were actually regional, which meant that 2 public health areas had influenza-like illness rates of 6% or higher, which means the percentage of people going to their doctor for influenza-type symptoms. As of the last week, week 52, we're actually seeing widespread, which is 5 or more public health areas with rates above 6%. And in fact, the preliminary information shows that the rates are considerably higher than 6%, even twice that or more.
We've been reporting on doctors' offices filling up, and DCH Regional Medical Center, for example, that hospital also reporting a lot of cases, more than 170 cases. Is this unprecedented, or is this kind of what I know it's above normal, but have you seen this before?
Well, I think it's early to say that it's unprecedented because we still need to gather in all of the information and then compile it together. But certainly we're seeing peaks that are considerably in excess of what we've seen in the last few years. Influenza-like illness activity in this last week is twice what it was last year at this time.
In Jefferson County?
Correct, yeah.
Wow, okay, so let's talk about prevention. I don't think we can talk about that enough. What are people doing right and wrong?
Right. So certainly the number one thing we recommend to prevent influenza is getting the flu shot. Now the flu shot has 3 or 4 strains depending if someone gets the trivalent or the quadrivalent. The predominant circulating strain right now is one that's not specifically covered in the flu shot for this year. It's an H3N2 strain, which is in the vaccine, but it's a different H3N2. So there's probably some degree of cross protection that's provided, but it's not the ideal protection that we would have liked to. However, it still will protect from other influenza like H1N1 as well as influenza B, and those are also circulating to a smaller degree.
And do the other obvious things, wash those hands frequently and kind of, isolate yourself if you've got some of those symptoms. And quickly, what are those symptoms?
Cough, fever, sore throat, body aches, chills, headache, runny nose.
You just feel like the crud, right?
Yeah.
All right, Dr. Kahn, thanks so much for joining us. You're watching Fox 6 WBRC.